put it on, if you put it on a resource on Office 365 calendar, then people can just self-check themselves in and out on this.
Okay.
If they just need it for just basic.
And those of you on webcasting, welcome. This is our seminar series sponsored by the Natural Resource Ecology Lab, the Ecosystem Science Sustainability Department, and the North Central Climate Science Center on managing for climate change. And we've had a really good series so far, and today is no exception. We have Kristie Ebi from the University of Washington. And her background has really been, is at least unique in sort of the climate change circle that I've been working with, in that she's been dealing with a lot of the public health issues and looking at how communities need to respond to climate variability, climate change, looking at how do they adapt to these type of efforts. Her work has taken her to many places around the world, and she's currently working in places like Central America, the Asian Pacific Islands, Asia. She's going to Burundi, or Bhutan soon in this trip, and consulting with them as well. She has worked extensively with and collaborated with the WMO, UNDP, USAID, Asian Development Bank, and others. Most recently, she survived Working Group 2. She was the lead for the technical support unit, which really does a lot of the background work and just the grunt work for the intergovernmental panel on climate change. So she's survived and been a couple of years away from that, so she's refreshed and going to provide some lessons learned related to health adaptation in low and middle income countries. So turn it over to you.
Thanks, Dennis. And thank you very much for inviting me. I really appreciate being here. I have a series of slides. I'd be delighted if you would ask questions as I go along, because otherwise I just stand up here and I talk too much. I don't know, does this still work if they do that?
Yeah, let me get your,
That should work.
let me get.
But it's,
Yeah, it does.
no, it does.
So can use.
All right, so I'm going to start with a basic background on health and climate change. Try and get out of the way of this. It's a nice slide put together by the Centers for Disease Control and Prevention. And in the middle, you see some of the changes that come with the changing climate. Around that, you see some of the kinds of exposures that then change, that are important for human health, for human well-being. And then around the outside, you see a partial list of the health impacts of a changing climate. If you work in health, you can recognize that all of these represent nearly everything that a Ministry of Health needs to deal with. So this cuts across all the programs within a ministry. It's a very large mandate for ministries and departments of health to try and take on. And I'll talk a little bit about what we've learned about how countries are managing that. I want to start first with an important framing issue. This came out of the IPCC special report on managing the risks of extreme events and disasters. And it makes a couple really important points. One is it's not only climate change that we're looking at. When we look at the future, we're looking at risks, we're not looking at impacts. It's really important when talking with decision makers to be clear. Impacts are what you can observe, risks are what we're concerned about in the future. So when we look at our future risks, risks are composed of three basic factors. One are the hazards created by a changing climate, sea level rise, storm surge, extreme precipitation events, and on and on. The human and natural systems that are exposed to those. That in public health, we often conflate exposure and vulnerability, the third factor. In fact, they're different, and it's really useful to have them separated. The same strength typhoon has hit the Philippines and has hit Japan. Different typhoons, same strength. Very different consequences because you don't have the same exposure. And so thinking about the systems that are exposed is really important. And then there's the underlying vulnerability of those systems. What do we know about the sensitivity of the populations, the ecosystems that are exposed? What are the capacities to manage those kinds of changes? And so you need to think about all three when you're thinking about adaptation to climate change, because all three are important for what kinds of risks you're likely to face. And then the rest of it is, socioeconomic processes feed into risk, and you've got natural and anthropogenic climate change. From the perspective of the health sector, there's a couple other points that are important. Is all the health risks of a changing climate are current problems. We're not talking about something fundamentally new. As in ecosystems, you're seeing species change their range, but from a public health perspective, if you're worried about malaria changing its range, we already have programs that manage malaria. So we're looking at how we take the programs we've got in place and modify them so they take climate change into account. In public health, when we think about how we manage issues, things are divided into primary, secondary, and tertiary prevention, which translates into regular English into reducing the exposures, preventing the onset of adverse outcomes if you can't reduce those exposures, and response and treatment if adverse outcomes have already started. And within these, we've got a whole range of policies and programs that are in place. So the good news is we have a lot. The bad news is none of this was established taking climate change into account. I put the picture on the left mostly because I enjoy it. It was from, basically it was an advertisement in the late 1800s. In the late 1800s, for those of you who recall your history, the major port in the US was New Orleans. And New Orleans started to have a series of challenges because of outbreaks of yellow fever. Yellow fever can have a mortality rate of 30%. Ship owners then were not a whole lot different than ship owners today. They were shipping their goods into New Orleans. There was concern that the sailors had yellow fever. The ships were put into quarantine and they couldn't offload their goods. And so this is the port of New York City. Look how nice and clean it is back there. This is public health. Her shield says cleanliness. Isn't she lovely? She's an angel. You can't read this. This is quarantine. And this is smallpox, yellow fever, and cholera. And it's just the point, they're advertising, you can come ship to us, which is really did what happened. But it also points out that public health has been dealing with diseases that are sensitive to weather and climate for a very long time. We just haven't done it explicitly within our policies and programs. I didn't actually need to put this in, but it's fun, so I put it in because I find it enjoyable. As I mentioned, part of vulnerability is capacity. A group of people have gone through and got data from the World Bank and others of what each country leads the world in. So the US leads the world in Nobel laureates and being killed by lawnmowers. Canada leads the world in maple syrup and asteroid impacts. Australia, deadly animals and melanoma. And you can read these, and they are really quite funny. You can read this on the web, and you can blow it up for each country. The story I always like to relate is the Netherlands leads the world in being tall. And I was in an elevator recently, and there's two very tall men speaking a language sort of like German, who said, "I bet you can't guess what we're speaking." And I said, "Dutch." And he said, "How did you guess?" And I went, "Oh, I don't know," right? Because you're way up there. But it is quite funny, but it also makes this really important point of adaptation is national, but it's also subnational, it's local. That there are lots of different capacities and you need to take these into account. First time I used this, I was talking in Brazil. They lead the world in FIFA World Cup titles, and that made them really happy. Within the health sector, we have a framework for climate resilient health systems. We have each organization, CDC and others, WHO, have come up with basic building blocks of health systems. They're all sort of the same. Some are grouped a little bit differently. And then around that, there's a whole list of issues that need to be taken into account. So I showed you before that climate change cuts across nearly everything that a ministry does. But then you start looking around, you start seeing the number of changes that need to be made: leadership, governance, health force, research, technologies, and you go around. So there's quite a lot of work that needs to be done. Within that context, I did a review of the first 5 years of health adaptation projects that were done in low and middle income countries. So these are the 14 countries that were included in that review. There were 3 basic projects. One was funded under the Global Environment Facility, the Special Climate Change Fund, and it was for 7 low and middle income countries. Under the Millennium Development Goal Fund, there was a number of projects that were funded to try and achieve the Millennium Development Goals. 2 of those had, 2 or 3 of those, I've forgotten at the moment, had health components, so I looked at those. There was also a project funded around Eastern Europe by the German, it's kind of like the German Development Organization, GIZ. And so I looked at all the documents. And I've got a bunch of slides, and I'm going to talk through these super quickly because it's just methods that we can go back to later. So I looked at all of the summaries, the midterm evaluations, the final evaluations, whatever documents were available. 3 countries were in 2 of the projects. One of the pieces that we might want to talk a little bit about later is how you think about success in terms of adaptation. There's a lot of debate going on in the adaptation community. You've got a 4-year project. In 4 years, you're not going to be adapted to climate change. But how do you think then about what benchmarks you put in place to try and measure success? And so we spent a lot of time talking about that in the context of the data that were available in these documents. These were the issues that I looked at in particular. In addition, I worked with someone at WHO who did qualitative data collection. She took semi-structured interviews with 19 key informants and a focus group consultation. These were all from the UNDP GEF project that I mentioned before. So we had more in-depth information from some of these projects than for others. This is a long list of going through these documents of the kind of information that I collected. Looked at success, where we had talked a lot about how we were going to determine what success meant, good practice examples, opportunities to enhance the effectiveness of ongoing projects. So how could we take what we've learned from this and apply it elsewhere? And looked at barriers and challenges. One of the issues, this project was overall funded by GIZ, and GIZ was particularly interested in the issue of scaling up. And so we also had discussions around how you think about scaling up based on what you've learned in a 4-year project. What does it mean to scale up? Which is not always perfectly clear when you look across the literature on scaling up. It's quite a mixture of what people think about scaling up and what they're scaling up to. This is a list of the key themes that came out, and I'll illustrate some of these with some examples. These are all sort of obvious. So we've submitted this for review to a journal, and first set of reviews came back and they went, well, it's sort of obvious that you would come back with these kinds of comments. It's like, yes, they are kind of intuitively obvious, but there wasn't documentation, in fact, that these were important themes. So it's yes, we know you need to have a clear vision, but it's not always just, it's intuitive you need a clear vision, but it's not necessarily clear what it means to have a clear vision, if that distinction makes sense. Having strong country ownership is really important. And all of the adaptation funds are going more and more to very strong country ownership and tying in with what the country thinks its priorities are around development. So making sure that you fit within this development portfolio and that the country leads the way. Again, that sounds obvious, but if you look across the UN organizations, many of them come in, many of the development banks come in and tell countries what it is they have to do. and there's less of a partnership and more of a top-down activity. A second is something that goes a bit against the way most of the adaptation projects have been structured. They use log frames with outcomes and outputs. And in fact, greater impact was achieved when they focused less on those outcomes and outputs, but more on the overall objectives. So you saw projects where it's more, we promised we would train X number of people, so we trained X number of people without the broader context of why are you doing the training? What are these people going to be doing for the next 10 years? What's your overall objective? And making sure that people think about these overall objectives. This one in particular has broad implication for a lot of the adaptation funding, because countries work out these log frames, these outcomes, these outputs that they put together. The money comes through, they need to start immediately. And there isn't time to sit down and really think through those objectives and how they tie back into development goals. And that came out very clearly from some of the MDG funds, where there were comments in some of these evaluation reports that a country in particular took a long time to get the project started, which was frustrating from the part of the development partners, because they spent the money, they want it to start right away. But in the end, that country achieved a lot more because it thought about its objectives. How does it fit with development? And it was much more co-production, as we would call it. Of course, multi-sectoral approaches you have to have, surprisingly difficult in many locations to this day. I'm doing a project in a country in Africa, I won't say on the web, where we would like to have a partnership with the meteorological services. In Africa, most of the meteorological services have almost no funding, and they've gone to a model where if you want anything from the Met services, you have to pay. And you often have to pay significant sums of money. In this case, because my project is with a large development partner, and the Met services know that, they want $150,000 to have access to weather data. I know researchers in Africa who've gone within their own country to ask for weather data, and they've been asked for somewhere in the range of $5,000 to $10,000. And this is outside the bounds of projects. So this is a real problem and is very difficult to address. In one of the countries that I reviewed, the country views air pollution data as something that's part of almost their national security, and you can't get access to air pollution data. And so it's very hard then to look at what happens when you have episodes with high concentrations of particulate matter if you can't actually find those data. Building capacity, building stakeholder engagement. Many of you work on projects, you understand the importance of doing that, reinforced how important that is. It's also important to establish enabling conditions across scales, and that's by scales of governance from local to national. And it's quite interesting how different every country is and how they organize their health sector, who delivers healthcare, whether it's delivered by a Ministry of Health, whether it's delivered by a National Health Service, whether some of it's delivered by an NGO, and you find a mix of those in all countries. I've worked in countries where the Ministry of Health and the National Health Service don't necessarily have a great relationship. And so trying to establish those conditions across the scales is interesting. We'll just leave it at that. Institutionalizing risk management. On one hand, that's what public health does. We do risk management. On the other hand, public health knows how to do top-down activities. We've got a problem with Zika in Florida, and a lot of money will be spent, if Congress will sign off on it, to develop a vaccine. And so it's kind of a one-off activity. It's not an ongoing risk management approach. It's not looking at why we're having introductions. It's not looking at why Aedes aegypti and Aedes albopictus are spreading around the US. It doesn't really take a risk management approach. Indicators. We all know we need indicators. They're surprisingly difficult. The health sector has been focusing on the kinds of indicators it's used historically. We're really good at counting bodies. We can tell you when people die of things. We're talking about climate change, which is about the future, and trying to get a sector that almost always looks historically to start thinking about future challenges and how you develop indicators has been a slow process. Knowledge building, many of the countries are moving. All countries want to make sure that when you have a project, you build capacity within the country. That's critically important. But many countries have realized in the short term that they are going to need external experts, that they're going to have supplementation of expertise for some time until they build their university systems, until they have enough people trained that they, in fact, can take over the issues. I'll mention several projects that address both adaptation and mitigation. They used an adaptation project to undertake mitigation, which was great. And then the obvious, you need clear design, good management, all of that, which is important for any project. So with that, almost all the studies started with doing basic vulnerability and adaptation assessments. It was a way that most countries started looking at this issue that has been infrequently done until the last couple of years. In the US, we've done a series of national assessments. US is starting on its 4th. Most countries are not that far along, and there's still a lot to learn about the vulnerability to a changing climate and which particular groups are more vulnerable to those changes. One of the questions we were asked quite a lot when we put this paper in for review is, how did countries choose which projects to focus on? Because the mandate is so large. And they basically focused on what could we do in 4 years. It's not necessarily the highest priority, but some of the highest priority issues like undernutrition are incredibly complicated. And given you're starting with a very limited knowledge base, very little capacity, taking on a really big task just didn't seem like a really good idea. And I think they're right. So they started with what they could achieve within the context of this project and context of really quite limited budgets. I talked a bit about targeting communities, ensuring that you have full implementation. There was a really nice example here from Kenya on home-based malaria case management. And we can talk about this later if you want, but these projects really worked hard to try and make sure that they collaborated with the communities, and the communities had ownership of parts of the project. In terms of working across scales and working across ministries, Bhutan did an absolutely incredible job. Bhutan is a vertical country, goes from a few hundred meters to the Himalayas. And Bhutan has been watching malaria and dengue fever change its range. It's just moving up. I had an opportunity a little over 2.5 years ago to meet with some volunteer healthcare workers. Each village has a volunteer healthcare worker. Most of the population engages in farming. These are pretty much farmers. They get training once a year, and as part of the project, whoever was the volunteer for those particular target villages came in for training. And I wish we'd had a video camera when we talked with the folks that we spoke with. One of the farmers started talking about that when I asked the question of what changes had they seen in their lifetime. And this one farmer started talking about when he was a kid, he always knew it was time for the fall festival because there was snow in the mountains. And in the course of his lifetime, there's no longer snow in the mountains for the fall festival. When he was a kid, he doesn't remember mosquitoes. He was a kid, there could have been mosquitoes, or might not have been mosquitoes, but mosquitoes were not a big issue. And I was there April 2 years ago, and everyone in the village was sleeping under bed nets. And the hospital said the closest known case of malaria was 6 miles away. That in their lifetime, he's gone from not being at risk for malaria and dengue to any day now they're going to have it in the village. And so it's an incredible transition that they're seeing. There's a very strong collaboration that's been developed between the Ministry of Health and the meteorological services. They're developing early warning systems. They're working with communities to implement these early warning systems, and have gone from a country with very little capacity to one of the outcomes of the project is the Ministry of Health now has a full-time person on climate change and health. who works with the various other groups. They've got a national climate change team, works directly with that climate change team, and has made a fundamental shift in how they're approaching issues in just a few years. Uzbekistan is another country that made some real shifts in just a short period of time. The meteorological services are quite strong in Uzbekistan. They had a really nice database of all their weather data, and they started importing health data into their weather database so they could start doing analyses. The visits out to some of the target communities were particularly interesting in the sense that none of their medical records outside of the capital, I can't say none, but the ones that I knew of, none of those records were captured electronically, that people are all using paper records. And so my visit amounted to going to visit people in their offices, and they showed me their laptop. They showed me they knew how to turn it on, and they showed me they knew how to enter data into an Excel spreadsheet to show that they knew how actually to capture this data and put it in, and that's imported then, as I said, to the Met data. So they're doing analyses. They're particularly concerned around diarrheal disease in summertime, that as the weather gets warmer, there's less water available. When there's less water available, people tend to use water differently. So diarrheal diseases tend to go way up when you have limited water supply. Jordan is one of the 10 most water-stressed countries in the world. They have multiple, and I forgot how many, they've got multiple agencies and departments that work on various aspects of water. It is critical for their survival. And as part of this project, Jordan was both in the Jeff project and it was in another project I was able to get funding for, is trying to bring some kind of coherence across government agencies and how they manage water. It was decided some time ago that Jordan had to start using treated wastewater for agriculture. They really have no other choice. They started using treated wastewater. Diarrheal diseases started to go up around in the communities around where they're using treated wastewater. The assumption was, therefore, there's a problem with how they're treating the wastewater. And over the course of the project, funded research through the National University, and it looks like it's much more how people are using their water than the fact that the treated wastewater wasn't treated sufficiently enough. And so are working with how to ensure that people use water appropriately so that you don't have outbreaks of diarrheal disease when you are in such a, again, a situation with very limited water. But trying to bring coherence across agencies has been a real challenge, as one can imagine. Heat was a theme in several of the studies. Heat kills. As you know, in the US, we have heat waves. People die in heat waves. All the morbidity and mortality in heat waves is preventable. Unfortunately, I don't have slides. The project in China just did an incredible job, absolutely incredible job. They focused on 4 cities. They did a series of analyses and developed this incredible outreach material, videos, worked with communities. This is not an example from China. This is from India, a heat wave early warning system that's been put in a very large city that's relatively close to Pakistan of using outreach materials. The program in China reached down into the schools, training school children so that they could help their families understand. One of the first symptoms you're getting into the heat, getting into trouble with heat, is you get confused. It's not terribly a useful symptom. So you need to have people around to make sure that people are paying attention, that there's ways to tell when people are getting into trouble with the heat. It wasn't in China, but as part of another project in India on heat, thinking about the ripple effects of all of these challenges, there's a number of healthcare centers in India that have been put in that have asbestos roofs. And they're having heat waves where temperatures have been getting up almost to 50 degrees C. And people, the physicians will not go into the healthcare center. They're treating people outside under trees because a healthcare facility is too hot. So there's lots of implications of these that need to be addressed. These projects were pretty small focused, but they did bring up some of these issues. I also didn't need to include this slide, but this was a heat wave in China, and this is a public pool. Yeah. Ew. The governance issues, as I said, are really interesting. Every country is different. This is Indonesia. It was not part of that project, but Indonesia has just an amazing government organization dealing with climate change. That the previous prime minister said climate change is really important for our country, set up a national climate change team that reported to the prime minister. And for years, all of the ministries met on a regular basis to talk about climate change. They have got integration across the ministries in ways few countries do. They also have the vertical integration. So I went to a farmer field school and talking with them about some issues, and the farmers raised all kinds of issues around health. Someone was with me from the Ministry of Health, and the Ministry of Health said, great, we've got a whole bunch of training materials. We're gonna work with the Ministry of Agriculture on those, and we're gonna try and get some of those into the farmer field schools so we can address both the concerns about saltwater intrusion into paddy. They're having problems with rice production, as well as the problems they're seeing from the health issues associated with that. When you see saltwater intrusion into fresh water, there's some really good studies in Bangladesh showing that hypertension in pregnancy goes way up, along with adverse outcomes for both the mother and the child. So it's a serious issue to address. And there's ways within Indonesia they can do this, as I said, across ministries and vertically. It's really quite impressive. One of the things they're really concerned about is dengue fever. And to give a sense of the complexity of dengue fever and trying to sort out how you're going to manage dengue fever, dengue is carried by 2 species of Aedes mosquitoes. The most common one is Aedes aegypti. Aedes aegypti loves humans. It will fly a mile to bite a human over anything else. If you're paranoid about mosquitoes, Aedes will come and find you. It's really, and it's adapted to our environment. Aedes breeds in small amounts of water, can breed in the water in the bottom of a flower pot. And so to get rid of Aedes, you have to clean up every breeding site everywhere. This is Singapore. I'm not sure this is a picture of Singapore, but in Singapore, there was an outbreak of dengue. It's a nice tropical environment. Somebody from the ministry there said they've got 3 seasons, hot, and really, really hot. They have a significant problem with dengue, and they have the best dengue control program in the world. In Singapore, people, and I don't remember if it's a ministry or some other civil organization, has the right to go into your living space and check that you've cleaned up all the breeding sites. And if you don't have those cleaned up, you get very large fines, like hundreds of dollars of fines for not cleaning up breeding sites. And they're really working to try and control dengue, because that's really the only way you are going to do it, is have no breeding sites. Several years ago, they had a very large outbreak of dengue. They were going to people's houses. They were trying to figure out where it was coming from. And they kept going back and back and back. They couldn't figure out where Aedes was breeding and trying to figure out the source of this outbreak. And eventually they discovered Aedes was breeding at the end of the standpipes that people were hanging their washing out on. Those little metal pipes that come out could breed in the water that accumulated at the end of those pipes. To give you a sense of how big this challenge is. And we're making this even worse. I have not done this, but colleagues have. They say if you go down into sewer systems are warm and they're moist, and they have millions of mosquitoes because it's a great place to breed. So we're setting up infrastructure that is just perfect for Aedes to breed in. We have large cities, so we've got lots of people that Aedes can bite, and we're creating even bigger challenges with trying to control these vector-borne diseases. Early warning systems are starting to appear for a number of diseases. This is one for dengue. This is in Singapore. And this shows they did a forecast system, which many of us thought would not be possible. It's a hot, moist climate. they can get dengue most times of the year, not all times of the year, but most times of the year. And it didn't seem a place where there'd be a strong environmental signal. But this is a student who did her work up in Sweden. And you can see that she did a really, really nice job with this forecast system. It was based just on temperature and precipitation. This is the actual. She missed the peak, how high the peak was, but you can see that she achieved matching this well enough that you could tell where the threshold was and you knew when to take action. The most important part is buried down in here is this system gives 16 weeks notice. So you've got 4 months before an outbreak to go and really make sure people know how to clean up the breeding sites, make sure that they've cleaned up the breeding sites, to go around and do the kinds of interventions that need to be done so that you can avoid this altogether. And we're starting to see more use of this. Public health has been pretty slow on using environmental information, and we're starting to see some great examples, and this is a great example. Another is the European Center for Disease Prevention and Control got involved. There was an outbreak a couple of years ago of malaria in Greece, and it was locally acquired malaria. It's called autochthonous malaria. The European Center for Disease Prevention and Control has been building this big environmental database where they've got environmental and health information, including climate information. And they analyzed all the environmental determinants of where that outbreak occurred, and then identified everywhere else in Greece that had the same environmental determinants and did proactive spraying. They didn't see more cases. You don't know if you would have anyway, always a problem with prevention. But they didn't have any more cases, and they were able to go out and reassure the public that they thought they really had contained the outbreak. Many countries are working towards developing the health component of a national adaptation plan under the United Nations Framework Convention on Climate Change, now as part of the nationally determined contributions, which, by the way, is going into force because the EU has signed it, which is really exciting. So this is from Thailand, and they have developed their own national adaptation plan for the health sector, so they know what actions that they need to take. And more countries are moving in this direction. And as I've emphasized all along, it's not easy. This is an outline for Thailand of the different mechanisms they have within their health system. And so it is pretty complicated to try and figure out how you're going to connect all of these different pieces with the Ministry of Public Health in the middle with various other components of your national system, your NGOs that together work to make sure that the population health is protected to the extent possible. I mentioned adaptation and mitigation. Here's an example from Kurdistan where they're doing an adaptation project and used the adaptation project, which was looking at some of the healthcare facilities to improve these facilities. So installing water heaters, photovoltaic power plants, and this was the first large-scale implementation of renewable energy in the health sector in this country. And it was great that they were able to do that within the project. They had slightly more funding than some of the other projects that I've mentioned have had, so different countries have had different ability to take this on, but it was a best practice example of what could be done. I have a few more slides, getting close to the end. Scaling up, I said there was key informant interviews, and it was interesting from the key informants, most of them were from Kenya, of what they thought would be important for scaling up community level engagement, interventions around air pollution, adaptation and mitigation, malaria control programs, safe use of wastewater, and integrated approaches to looking at water scarcity and undernutrition. And they thought that there was real opportunities for taking what had been learned at community scales and moving these then to the regional scale within the country and to the national scale. Challenges, a lot of what you'd expect, real challenges with political will and leadership. Climate change is a new issue for many of the ministries of health. Ministers have lots of issues they need to focus on. Climate change often doesn't come very high on their radar. They often don't provide the political support and the leadership that's needed to make climate change more integral into what the ministry is doing. I've talked about data access. An issue that came up time and time again is, several of you in the room know, there's very little funding around the issue of climate change and health. One of the consequences of that, there's very few projections of the health risks of a changing climate. And so when countries were looking at what is it that we need to adapt to, we can look at our current vulnerability. We can address vulnerability to the current climate change, current climate variability. But what do we need to think about for the future? There's very few projections for them to work with. And that just is an activity that's been rarely funded. There was lack of a technical consensus on what are your standards for implementation. Different countries were taking different approaches on implementation, different ways of intervening on policies and programs. There's not enough of those yet for there to be a standard approach that you could give to a country that they could use as a template. Limited human and financial resources. I talked about indicators. And there needs to be a better evaluation of what the capacity is within a country so that you can strengthen that capacity for adaptation and implementation. And this goes in many different directions. An example is I had a meeting with the head of the major medical school in Uzbekistan who said he really wanted to have a climate change component in his medical school training. He wanted to make sure all of the MDs that came out knew something about climate change, and said, where am I going to get somebody who's trained enough to teach that? And there's no answer to that. There's no place for somebody to go to get that training. WHO, with support from a number of different development partners, has been running quite a few training programs. They're focused on ministries of health. They don't train the universities. And so one of the things I've been trying to do is see if we can get funding to get training for people in universities so you can start building that capacity within the universities for the understanding, for the research and development, and also because people from the universities flow back and forth with the Ministry of Health. So it would help a country from both dimensions. For the key informants, what kind of support do we need? And you can see these are just the percentages. Community involvement, adequate capacity. They need a policy. They need to be able to justify the work that they're doing. They need support, data sharing, and you need funding. This is a fairly small number of responses on this, but I'm sure if there's larger numbers of responses, that percentages would change, but not the basic categories. So there's a lot that still needs to be done in this space. So overall, we concluded that no matter where countries stand, the low and middle income countries in terms of the resources, they really need to start taking climate change into account. That there's a lot that can be done with a very limited amount of money. Most of these studies that I talked about had fairly limited funding. And there's a lot that can be done to move forward, at least to get started, to think about the process of adaptation. You can do a qualitative vulnerability and adaptation assessment to get a sense of where you need to start. You can start setting priorities. You can look at your policies and programs. There's things that are pretty inexpensive. You can't address it all, but you've got the process started. And that is, you have to do that before you can do much else. If you don't have the process started, it's going to be more difficult to attract additional funding. So it came out with a clear statement that there's a lot that needs to be done and everybody can start now, no matter what their situation is. And then finally, I thought I'd leave this from the China study of one of the children involved in one of their education and training programs drawing this poster. So thank you very much.
That's fascinating. So given your experience in all these other countries, how would you assess the United States and its ability to deal with these issues?
Yeah, we talked about that the other night. The United States is interesting that we certainly have the resources. And there's lots of ways to answer that. We are not supporting climate change and health as an issue within the US that's important. the Office of Management and Budget recently did a review of the NIH budget, and the total NIH budget going towards this area is 0.02%. When you're in Washington, D.C., people talk about budget dust. 0.02% doesn't arise to the level of budget dust. It's some kind of microscopic something you'll never find on the floor. So we don't have that support. We have the U.S. Global Change Research Program, which is working to coordinate across agencies, is leading the national climate assessments. And those, if you haven't looked, the national climate assessments have done a really good job in looking at the risks in different sectors. One of the challenges I see with USGCRP, or two of the challenges I see with USGCRP, is the focus has been around the agencies. So how do the agencies work? What is NOAA doing? What is NSF doing? And how are they getting the information that they need? So one of the president's executive orders was focusing around access to data. But that isn't about access at the state level, at the community level. So there's not the reach out. It's an internal focus on agencies and making sure agencies have their adaptation plans. But there's not a mandate then to help the rest of the country, which I think is a really significant problem. The other significant problem I see with USGCRP is it's still focused on there's a health assessment, there's an agricultural assessment, there's a water assessment, and there aren't the cross-sectoral assessments. We're in an area where you've got problems with water, you've got problems with fire, you've got problems with land management, with climate change, ecosystem change, you've got health issues that arise, and looking at these separately are not going to get us to the comprehensive solution. So you don't see that systems-based thinking that you see here at the university. That still has to take place at the national level, and to think about conducting assessments so that there has been efforts, as you know, about land, water, and energy, which is one place to start, but it needs to flow out and there needs to be more of those.
We have time for other questions, sir?
Yeah.
Speaking on evaluations for success and how you involve communities, in those evaluations for success that you mentioned, I think near the beginning, were there concerted efforts to involve Indigenous communities or marginalized populations in the community involvement steps?
So in health, we always have a focus on vulnerability. So we're always worrying about servicing those who are the most vulnerable. We don't call that out as much as we should, but we do work with those communities. One of the interesting things that came out, particularly in the Jeff project, was trying to think about how you measure how the process is going for these projects. UNDP has a vulnerability risk assessment tool, or risk assessment tool, VRA. And so it was decided the project was going to use these VRAs. And it's basically going out and asking people's level of understanding. And this is designed with the implicit assumption that people will improve their understanding. And so you're going to start out with thinking that you have really high vulnerability, and as you understand more and you implement the project, that your perception of vulnerability is going to go down. In fact, in many of these places, the perception of vulnerability went up because they thought, oh, we're not in such a bad situation with climate change. And then the more they understood, they were going, we have a problem here that we didn't understand. And so it was interesting writing up these evaluations of why would the vulnerability perception go up. They know more. And so yes, there was efforts to engage at different scales. It's a little different for the health sector than other sectors because you've got healthcare facilities everywhere. And so a lot of this comes through healthcare facilities, but there's also work with the local community in some of the projects. You're welcome. Yeah.
So I've also been involved with some capacity development internationally. We started out much as you had in your slide here. You go out and most of the projects were funded by AID. So you tell them how many people came to the training and
right.
all this, and you check all the boxes and they're happy. But we quickly realized that we weren't really building any capacity. We were, meeting people and sharing some information over a few days, but they weren't really going back and using it.
Right.
So we started to change to more of, I guess you could call it more of an institutional focus, where we worked in first setting up institutional arrangements, and then focus on the people who really have these jobs, rather than just them sending some people to meet with us for a workshop. And we've had mixed results with that. It's been more successful than our first efforts, for sure. But the big problem we see is turnover, particularly in these lower income countries that we work with, that once somebody gets some knowledge, then all of a sudden they're a real commodity to go out in the private sector or somewhere else, and they don't stick around. And I don't really have a solution for that. And I was wondering if in your experience you had come across any way to develop that continuity. I mean, this is going to happen. I mean, it's just, I don't think there's any way to stop this from happening. But how do you develop that continuity as teams change and turn over?
Yeah, I've done a fair amount of work with the UNFCCC Secretariat, who's plucked the best and the brightest from low and middle income countries around the world. So you work in a country with these great people who work on climate change, and the next thing you know, they're in the Secretariat and saying, maybe there's a way to balance this. I think one of the ways is to try and do more efforts around the universities. That if you can get this education and training embedded in university systems so that people have this as they're going through the university system. First of all, you've got a bigger pool to choose from when you do have turnover, which you will have turnover. And those people then go out and they can work in the ministries, they can work in the NGOs, but there's more coming up behind them because you continue that training. I just don't see any other way to do it. And so trying to get more focus on the capacity building, you need it in the ministry, but ultimately if you don't have it in the university, you're just going to continue to train and retrain and retrain, because that is it's a chronic problem, particularly in really small countries. And we can't stop people changing jobs. People should better themselves and have every right to better themselves. But if you know that you've got a program that'll support underneath providing more people, I think you'll get to a better place. It'll take several years to get there. If you see something else, it's the only thing I can come up with.
It's really interesting you say that, because we just had the university here has a program through the EPR, the research vice president research office, in which they were targeting how to get research out and impacting education more. And so we actually proposed something along the lines of working with two countries, Colombia and Ethiopia, to work with the government staff, but also with the institutions, the academic institutions, to develop this capacity. And the VPR's office like that, just like we're doing a project along those lines, not taking the work that we've been doing with some other folks, focus just on the government staff, but expanding it out now into institutions. So it's interesting that you brought this up.
One of the things you could look at is the International Institute for Environment and Development, IIED. The person who ran the climate change work for a long time was Salim al-Haq. And Salim also has an appointment at the Independent University in Bangladesh. And several years ago, he started I think they're 8 or 9 day training courses. We haven't been able to get money for health, but he's got them, for example, for infrastructure. And he's got David Satterthwaite and others who've been running these things. And they're designed, I like the way they're designed. Basically, people have to get to Bangladesh. Once they land in the airport, Salim takes care of everything. It's all set up. You get picked up, the hotel, the food, everything's covered. And you have 5 days of training, and this can be for anybody. And they've been getting really good response to this. And as part of it, they also have a field trip, because there's all these, I've got great stories of Bangladesh and quotes that often so Bangladesh has got great stories. I'll tell you one at the end. So people go out and see something about areas in Bangladesh that are working to reduce vulnerability, increase resilience. And they get people from all over to come in. So you've got this 1 week intensive training, and anybody can come to these. And I think he's gotten support from Rockefeller and from some others to do these kinds of courses. And so it's having a mix of being able to do it in country, which is the best, but it also costs a lot more than perhaps setting up a whole series of training courses somewhere where you've got 25, 40 people come in. You've got the people that you'd like to have train be there, have an intensive experience, and they can take the material back. Ultimately, people, of course, would like to have both occur, but taking a look at that as a model might also be cost effective. And as long as I mentioned Bangladesh, Salim's been leading the community-based adaptation meetings that occur now every year. And as part of these, they always have a field trip. And so one of the really great quotes that came out of one of the field trips is one of these groups went down into the Bay of Bengal where they've got a lot of saltwater intrusion into paddy rice, talking to a farmer about climate change. People are always blown away when you go to Bangladesh on how much illiterate farmers understand about climate change, that there has been amazing education and training. And they're talking to the farmer and she's explaining the problem she's got with saltwater intrusion and how the rice doesn't grow very well and the whole series of challenges you can imagine. She pauses, she lets a translator translate, and then she says, climate change has a taste. It tastes like salt. And so Salim has been using that, and Atik has been using that for a couple of years, that you get these amazing experiences when you talk with people who really are on the cold face of climate change. They're seeing the changes that are occurring, they're feeling the impacts, and they're trying to cope with them.
In your sort of knowledge and experience with the emerging sustainable development goals, it seems that there is an attempt to look at, with their fit for purpose sort of mantra, to look at sort of the country ownership, the buy-in, and also then looking at what really works for a particular country. So are you seeing advances now, or do how is that being implemented relative to public health issues?
The public health is very pleased, of course, with the Sustainable Development Goals. One of the challenges is that, I guess the upside and downside is we've got the World Health Organization. And so the World Health Organization is organized so it has regional offices. There's 6 regional offices managing all the countries. So we've got the Pan American Health Organization for the Americas. There's country offices among UN conventions. WHO is the most signed convention. More countries belong to WHO than any other UN convention. So they've got country offices and they work directly with the ministries. And so you have this well-established organization that works very well. And much of the work around the Sustainable Development Goals is flowing through this set of hierarchies to help the countries achieve the Sustainable Development Goals. But that doesn't include the academic institutions, that doesn't include the NGOs, and it doesn't include others. And so it's trying to find a way to balance that, because you're missing key partners when you focus from that particular aspect. And the development partners have either funded WHO or have funded universities, NGOs, and others. And I think we need to move to a model where it's joint, where we actively engage all the important actors within a country to make advances.
Within that bureaucracy, are there mechanisms for the multi-sectoral type of, your description of the need to really look across ministries and things? Is the WHO responsive to that?
Yeah.
Or do they have their own silos?
Well, everybody's got their own silos, but WHO's, the countries are responsive to this working across the ministry. But again, it's working across the ministry. And that has pluses and minuses, that it depends on what your ministries are responsible for and how the ministries function within a country, who's responsible for what within a country. And it's hard then to get your other partners in. It depends on how they work with those partners. It's easier with disaster risk management because they are used to working with the Red Cross and others. So that is easy to bring that part in. For some of the other ministries, it's a lot more difficult because they don't have that tradition. Yeah.
Any other questions? Otherwise, we want to thank Chris.
Thank you.
figured out how to turn this thing off.
Yeah, please.
Oh, great. No, thanks.
Well, I appreciate it. Thanks so much. It was great meeting you.
Yeah.
Good questions.